Have you ever wished to receive medical treatment without having to go to the dreaded doctor's office? Or ask your caregivers to take you there? Well, I have this wish along with many others, mostly in the aging population. In our current society, with the rapid growth in technology, telemedicine is one of the most pivotal concepts of today and tomorrow. After having researched this topic, finding various reasons from trained professionals, along with hardcore statistics, that telemedicine is indeed beneficial to our society and loved ones. It can directly affect our generation, our parents, and our grandparents. Finding the best possible care for our loved ones is something telemedicine can effectively provide at any given time. With the aging population growing fast, it is important to think of the types of care and how to access it in order to best help you and the ones you love. With technology taking over the world as we know it, telecare could be one of the most vital focuses of our future, learning, and investing in this idea is nothing short of revolutionary. In today's day and age, technology has certainly played a large role in the developing issues around us. Not only has technology enhanced medicine in today's society, but in some aspects completely remodeled and reinvented it. The Israel Journal of Health Policy Research opens a journal titled Towards 21st Century Healthcare System, Advancing the Case for Telecare, with telecare is increasingly recognized as an essential tool for a 21st century health digital care system. Compared to even a decade ago, technology advances are making it possible to mainstream telecare with the ubiquitous nature of personal devices that support video communication, the digitalization of care experience, and a rising comfort level with digital health by clinicians and patients. With technology, obviously comes communication. The 24/7 access it provides is something that adds to a positive when talking about telehealth. In the aging population, some patients need 24-hour care 7 days a week, or to at least be checked on and have questions answered daily due to their needs. This unlimited and easy access that is constantly available is something so revolutionary when we are considering around-the-clock care for our loved ones. The popularity of technology emphasizes the want and need to feel mainstream, which will in turn encourage many people to turn to it to use it no matter the circumstance. So the ability and access to technology is endless considering almost everyone has some type of electronic at hand. With this accessibility, we can cut down on the amount of visits, ambulance rides, and other issues that are very costly and unnecessary at times. Christian Duffin writes in his article about nurses seeing the positives in telehealth that in a survey that was taken that more than 90% of 850 telehealth patients surveyed that said that they benefited from telehealth. 70% said that it had reduced the number of unnecessary visits to a GP. Patients learn about what's usual for them and what is not. This reduced number of visits cuts costs greatly and allows for effective feedback almost instantly, rather than having to travel and wait in an office for quite some time. UTMB Telemedicine and Center for Telehealth Research and Policy ran a study utilizing telemedicine. They quote that the benefits for telemedicine can be readily seen through ongoing research and quality assessments. In a recent survey of 530 parents who are children received pediatric telepsychiatric care from UTMB Health. An overwhelming 88.5% reported that telemedicine made it easier for them to receive treatment by specialists, and more than 60% reported better changes in overall functioning for their children after receiving telepsychiatric services. This figure that I am showing is directly from their article and just drawn to a larger scale. You can see that the telemedicine program had made it to more than 90% easier to receive treatment by specialists. That is truly unbelievable and exciting. With this wonderful access and communication, it allows for the best doctors at the click of a button. Some doctors may specialize in a condition that may be overseas, but telehealth being able to be seen and treated by that doctor in the comfort of one's own home is something that is not possible without the privilege of technology. Finding the best care allows for the aging population to have a better quality of life without having to go into assisted living, which brings me to my next point, that telehealth directly benefits the aging population. Telehealth allows for the aging population to feel more independent and have easily accessible care, which in turn eliminates the need for assisted living, which is costly and can lead to negligence. Dove Press's article, The Use of Telemedicine-Based Care for the Aging and Elderly, Promises and Pitfalls, addresses the importance of telehealth versus assisted living. He quotes, that telecare allows the elderly to keep their independence and continue living in their own homes. With reduced mobility, simple, rapid online contact between the older person and the health facility, healthcare professionals becomes particularly important. Saving time on commuting and speeding up the diagnosis, minimizing duplication of diagnostic tests and clinical services, and enabling rational triaging of seniors. Telemonitoring and telerehabilitation help to reduce the number of hospitalizations and shorten their duration by providing some healthcare services in patients' homes, and the chronically ill patient can benefit minimizing the number of follow-up visits needed at the health center. So all in all, there are so many benefits that allow for the patient to receive better care at a better cost that is accessible and effective. What could be better than that? Having the all-around access allows for a sense of security and safety in the patient knowing that they have access to help at the push of a button. In addition, there are devices like fall detection technology or Life Alert that notify somebody immediately if there is a detected risk of injury or illness. Once again, aiding in the added sense of security and safety that helps the level of ease of not only the person, but the caregiver as well. The caregiver role is extremely important in the aging population, and with that being said, caregivers also have various benefits from telehealth. A peer-reviewed article found through Iona's library written on telemedicine and e-health states that most long-term care is provided by informal care services, that is, by the family. Caregiving is mainly provided by the spouse or the partner or other relatives. In particular, persons aged 60 to 69 years are more likely to be looked after by their spouses, whereas those from 80 to 89 years are mostly cared for by their children. Alongside family caregiving is the system of formal care, which is expected to grow as a result of the demographic decline of family members able to take charge of their elderly relative. The demand for formal long-term care services is expected to increase from 48.7% to 59.9% over the next 10 years. Numerous studies have reported very high rates of satisfaction with telecare, telemonitoring, and telephone contacts among elderly subjects. A recent study has shown satisfaction to be far higher with this type of service compared with other services such as home care, not only among the elderly, but also among their caregivers, because telemedicine appears to have a positive impact on their stress, anxiety, concerning the health of the elderly relation. With this decreased level of stress and anxiety, telehealth can also give the much-needed support to caregivers as well. When there is a burden placed among the caregivers, the situation can often turn sour and lead to negligence as a result. Avoiding this is key. Not only does this lessen the burden, but it can also help with time management. The caregiver will not have to take time out of their busy schedules to drive to excessive doctor's appointments or checkups. With telemedicine, those can be taken care of over the phone or computer fast and efficiently. According to the mHealth Intelligence, caregivers wear out because of the constant worry about the safety of the persons they're caring for. They're also being exposed to the person's behaviors and not knowing how to respond or prevent such behaviors. And finally, they often isolate themselves. Technology can help by monitoring and alerting in the case of detected safety issues in the home. Stove safety, water safety, wandering, etc. It can all also help mitigate environmental factors at home. Noise, lighting, temperature, thereby diminishing the chance of distress and resulting behaviors in the persons with dementia. Again, critical to think about when dealing with the aging population. Telehealth can be seen as an improvement in various aspects of caregiving. With that being said, not only does telehealth improve caregiving, but it improves the quality of life in aging persons and all-around medical care. It should be easy to see why telemedicine is an extremely accessible, convenient, and effective way to provide health care, especially when considering the aging population. Don't you want the best care for you or your loved ones, or even yourself?